Hi, folks. Jeff Clark here. I think it's 10 o'clock or 10:01, so I have a little tardy getting in there. Okay, folks. We're just going to kind of get rolling here. We don't have a PowerPoint for this, and originally we're just going to put together this marketing pack. We call it our Corona Marketing Six Pack. It was clever. It sounded, it had some, zazz to it. I'm not trying to be cute by this thing, and I don't want to call this an opportunity. It doesn't sound right either. In reality, it's just, this is a very serious issue, and it's affecting our nursing homes, our elderly, more than anything. If we're in the grips of this worldwide pandemic, it doesn't seem to be going away. Really no end in sight. And this pandemic has been especially hard, as we all know, on the elderly, especially the ones in facilities. America is by far and away has the most Corona deaths in our facilities, nursing homes, etc. No one's even close. Why is that? Well, first of all, the United States has the most long-term care facilities, nearly 16,000 of them around the country. And these facilities, they're very underfunded. They don't have staff. They don't have equipment. They're under a lot of scrutiny. They can barely stay open. So they're struggling. And the United States spends less than 1% of their GDP on the nursing homes and facilities. Other countries spend 2-3%. We're the lowest of all the major, industrialized countries on what we spend on our facilities and our care. Through that overburdened Medicaid system, and I've told people this when I was selling long-term care. If you look at the Medicare system and Medicaid. It was designed back in the 60s, Medicare was. This is when you had 11 people working, paying into a system for every one recipient. Now, in this day and age, you've got barely over 2 people working for every one recipient. And the recipients are using 2 to 3 times the dollars they used to use. The numbers just aren't there anymore. We've got a real crisis in our hand. We already knew this. The nursing homes are struggling. Medicaid's struggling. Medicare's struggling. And Medicare, by the way, they're cutting more funds. They're going to do more cuts. It's just not going to get any better for the nursing homes. So the other thing the United States does that's a little more unique is we tend to make the bigger ones, the economies of scale, because of the underfunding. We have these big nursing homes, big assisted living, sometimes 200, 300 residents. Other parts of the world, you don't see on the averages are 20 people in a facility. They're smaller little places. They're more compact. A lot of the care is done in the community. Other countries are a little ahead of us. They spend more money on it naturally, but they do try to keep people in their homes. They're community-based. So there's a lot more community-based funding for them. For whatever reason, our system steers them right to the nursing home. That's what Medicaid will not pay for people to be in homes. They figured it's going to be cost-effective to put them all in one place to care for them there. There are some states that are following suit with some of the countries out there. Minnesota, Wisconsin, and Washington State lead the way. In Minnesota here, we have what's called an elderly waiver program. Actually, my dad, his girlfriend had Alzheimer's, and we were able to get her qualified for that. That was helpful. I kept her out of. She had, Alzheimer's was getting worse. My dad wasn't able to take care of her, but she didn't have much of an income. They weren't married, so we were able to get her that elderly waiver program. And it got us some home care out there and really kept her there, at least for 6 months to a year that she probably wouldn't have been. So we do see a couple states moving that direction, trying to do more community-based care. But the reality is we're falling over to nursing homes. They're big, massive, lots of people in them. So Corona is just ripe to rip through those. So with the underfunding, this Corona just made things worse. Nursing homes are currently operating at 90%. 90% of them operate at a loss. The ones that are above, they operate at a 3% profit margin. With Corona hitting these nursing homes, already underfunded, over budget, operating at a loss, 90% of them. Now you throw in COVID. It's only going to make things worse, and it has. They need now additional staff. And they're having a hard time keeping staff. People don't want to work in a nursing home because they're worried about Corona. So you have to pay them hazard pay, time and a half. All the protective equipment they have to have. All the expensive cleaning and sanitations they have to do. If you don't have a cleaning crews, whatever, the normal office cleaning might be X amount of dollars. Well, a COVID cleaning is 2 to 3 times the normal cleaning services, and they have to do it regularly. They have to provide regular testing for their clients, for their patients, and for the staff. Of course, there's extra regulatory certifications and regulations that are found now with COVID. So the costs now are in some reports I've read, 70% higher for nursing homes. So they're already in trouble. They're 90% are operating loss. All this says that 65% of nursing homes will go bankrupt within a year in this new coronavirus era. Little bit of good news. Part of this $1.9 trillion relief fund, they actually did put $25 billion towards the assisted living facilities around the country, and assisted livings are really get picked on. Nursing homes get some love from the government. Assisted livings get next to nothing. So again, it's just part of how we do it here in America. And it's really kind of the problem is we look at the politicians out there, and I'm saying both sides of the aisle here. They all want to talk about they're not going to cut Medicare, and Medicare is going to be here for this, and we're going to fund that. We're going to prop this up. So we hear a lot of politicians making. We know politicians make promises. Again, both sides of the aisle here. My last thing I want to do is be political here. There are a lot of promises made in a lot of areas. One of the more dangerous ones that our government likes to do is they promise people they're not going to cut Medicare, and they promise people they're going to, prop up these nursing homes and the home health care, and what people hear then is that they get this false sense of security that somehow Medicaid's still going to be that safety net waiting for them for nursing home care if they need it. The government says it's going to be there. We're going to pump money into it. In reality, is with the numbers, it just isn't going to make it. There's just too many people coming. The senior population, we know baby boomers is going to double, triple in the next 20 years. We've all seen the stats. So you got a tidal wave of care coming as severely under funded area, and there's more cuts coming. So you have a government telling people they have this false sense of security that there's going to be something there for them. It's really a moral hazard that our government does. Our government just needs to literally tell them, sorry, you're on your own. You're not going to have any protection. So what does this do to the consumer, to the person out there? People are becoming acutely aware of how important it is to have a plan. Most of them understand you can't rely on the government, even though, again, the government's telling a lot of people they're going to be okay. But I think most of the people are realizing that the writing's on the wall. There's just not going to be the funds there. With Corona, and just throw some stats here, and I'm going to go through some of the things we have here. I think we have more than 6 items in this 6-pack, but these are just some stats that I've mentioned. 61% of people surveyed recently said they'd rather die than go to a nursing home. If you're receiving your care in a home care environment, you have a 3% chance of contracting coronavirus and 1% chance of dying from that. Conversely, if you're in a facility, you have a 37% chance of getting COVID and 11% chance of dying from it. So in a facility, you are 11 times more likely, 11 times more likely to die if you get your care in a facility. I've got a lot of Medicare supplement clients that wrote a lot on care back in the day, but I think in a 4-week period, I had 3 of my clients, Medicare clients, call me and say, "But Jeff, I'm really worried about these, the facilities and Corona, and I'm not really worried about necessarily, needing the care because I'm afraid I'll have a stroke or I'll break a bone or something. I'll be in a facility for 2 weeks recovering, and I'll catch Corona and die while I'm there. I won't die from the stroke or from a broken bone, but that's where they're going to, Medicare is they're going to put you in a rehab center. When people get older, they have to go receive their care in a rehab center for a couple of weeks, and then before they go home. And so, literally, I've had 3 clients just call me and say, "I need to have some long-term care. I've talked about it for a while." So this is just kind of like when people are calling you, your clients, they're calling you asking for it. I thought, boy, what if we were to mail out my client base and saying, hey, many of you are, and that's one of the pieces we put together is, there's many of our clients and many Americans are worried about, their care at facilities, and they're worried about the pandemic. And it's really put to the forethought their concerns. So, 73% of people have died from Corona in Canada have died in facilities. In the States, half our deaths are people that are in facilities. And by the way, that's a little bit under, in my opinion. A lot of states, I won't name names, but we had some governors, we had some people who underreported their nursing home deaths for whatever reason. I don't know whatever motivated them to, but if they contracted the coronavirus at the facility but died at the hospital, they didn't consider that a nursing home death, which is ridiculous. But so you have a lot of states. For example, you look at the New York area, New Hampshire, 72% of their deaths were in facilities for corona. The other states were in Maine, 61%, and then New York was only at 33%. So that number just seems off to me compared to everything else in the area. Pennsylvania was in 60%. Minnesota had 61%. Or if you average it all out, again, it's nearly 50%. I think it's more than that. Canada, 3/4 of all their deaths are the facilities. So corona is, quite frankly, attacking nursing homes. Never has there been a time in my career doing long-term care, there's never been a time that our services, our products are needed and wanted. People are scared. People are frightened. They, more than ever, they want to start planning ahead for this. Again, I pulled some more stats. You'll find these in some of the pieces I'm about to go through, but 87% of people I think it's more important to be cared for at home than ever before. 87% of people are saying, we always know people want to be cared at home, but 85% of people said it's more important that they plan for long-term care, and 81% of people surveyed said they need to look into long-term care insurance. So 80% of people are thinking about doing this and want to look into long-term care insurance. So that just tells me something. I got people calling here. I talked to our career shop. We have our internet generated leads. They're up 120%, more than double. People are looking for help here. We as an agent base, we kind of have, and I don't want to call it an opportunity. It sounds like we're cashing in on someone's, it's more of an obligation. It's more of a responsibility. This is what we do. It's kind of like we're the firefighters. We have a fire. The first time in my 25 years doing this, we have a fire. We have the weapons to put these fires out. We have the capability. We have the product knowledge. If you're in long-term care and you've been a long-term care specialist, or even if you've been kind of in it, your clients need you. They need you to send them a pre-approach letter. I promise you're going to get some response on that. Something as simple as, hey, many of my clients are asking about, long-term care or about, the long-term care insurance because of the pandemic and the fear of going to facilities, and 61% said they'd rather die, all these stats. Just writing a letter here to say that we do offer those plans. Give us a call. We'll design some home health care plans that can give you options, give you some choices. We always know that people buy long-term care for 3 reasons. The most important, of course, was choice and independence. Never been truer than now. Yes, it saves your assets and you can avoid burdening your children. But this choice and independence about where you're cared for, how much care you're getting, that where you're cared for is big right now. So I would just say this: people need you. As an agent, there's never been a better time. If you want to dust off your long-term care, maybe you've been tired of long-term care, you got too many declines, there's no carriers left. A lot of negatives I hear about the long-term care industry. But right now, it's the biggest needed product out there. Burials and long-term care insurance. And remember, we have home care only insurance plans for people who maybe aren't eligible or can't qualify for health to the full-blown or can't afford the full-blown long-term care insurance plan. We have short-term care plans, 1-year benefits with a 6-year nursing home benefit, which really, 90% of claims don't go beyond 2 years. So these short-term care plans are becoming very, very prevalent as premiums have gotten higher and underwriting has gotten tougher. So we've got the products. We even have True Freedom that will take you, basically, it's prepaid home care, so they'll take anyone as long as you're not in a facility. So with the portfolio of products like GoldenCare has, you have every tool you need to help, calm these people's fears. I do believe that we do a service. People think you're insurance salesman. You're pushing these products on people, and you name one person that when they go on claim in long-term care that they're not very happy with you, or you sold them fire insurance or you sold them burial. Hey, when people use these plans, they're pretty happy. Right now, there's a big peace of mind thing. There's a big there's a big, just a reassurance knowing that they have a backup plan. They have some type of strategy to kind of keep them out of that nursing home. All right. So I'm going to go through these pieces now. I have my soapbox here. There you go. I already covered a lot of stats are in here. So let's take a look at this. Don't mind that pitch there. That's a 1 minute version of what I just said. Okay. So Steve Moses really got us going on this. And so if you look at his white paper, this here has these little hot links in here. It's where a lot of the stats I just gave you came from. And actually, I didn't give you all the stats I had here. 172,000 deaths are in nursing homes and on and on and on. There's just all kinds of just not good things. So if you look at these things, these articles, every one of them are pretty good. They're 2 or 3 pages full of great stats. The COVID impact on the long-term care industry and how people are thinking. So you've got nursing homes, the coronavirus, and Medicaid. Good article. Because of you guys, I'm stuck in my room. That's that kind of ripple effect that people, the younger folks are saying, I don't worry about coronavirus. Well, as the younger people go intermix and kind of keep this bug out and around, these poor people in the nursing home, they're locked up in isolation saying, if everyone just stays home for a while like we have to, it'd be gone. But I think our society has had enough of it, and they're still out there intermingling. So that article speaks to kind of trying to explain to young people why they should wear a mask and why they shouldn't go in big crowds. It's not because of you, it's because of these old folks. They're isolated. They haven't seen their families or grandkids. Kind of makes you feel bad for them. I guess kind of paints a picture. The NIC points to the unprecedented challenges of skilled nursing as occupancy remains low. That's another thing I read, by the way, too. With these nursing homes, this loss they're operating, 90% of them. Here's another thing that's complicating thing for the nursing homes. Nursing homes get a lot of their profits from the rehabilitation services. When people have a surgery, a back surgery or a hip replacement, when they're older, they typically have to go to a rehab center for 3 weeks, 4 weeks before they can go home. So that's a more profitable thing because that's when Medicare is reimbursing them. They got therapy going on. They've got the room and board. So that's their most profitable people they get, and that helps kind of break even for them. Problem is with Corona going on, there is no elective surgeries. There are no more like hip replacements or rotator cuff surgeries, and so all they get is the Medicaid people, the very bottom barrel. So it's just another thing further complicating the nursing home's dilemma. State of the nursing home industry facing financial crisis and staffing challenges. That was the one where I got some of those stats from. Man, these nursing homes are hurting. I just reading myself, I can't imagine any client sitting there wanting to rely on Medicaid. Medicaid is just not going to be there. Going back to moral hazard. It's our job because the government's not going to do it. We as an agent base need to inform people about this. If you're thinking the government's going to be there for you, think again. There's just no money for it. More cuts are coming. These nursing homes are in trouble. So great article there. It talks about that. COVID-19 linked to substantial cost increases in assisted living. Same thing. These two here were really good about just painting the picture that these facilities are struggling. And COVID just made it so much worse. Spending growth on nursing home care falls far behind health and hospitals. They are, for whatever reason, they continue to just cut. And wait, what's happening? The bigger picture here. When you're cutting the funding in a nursing home, they get discharged. People are being discharged from a nursing home that have no business being at home. I ran into this with my dad. He had a broken bone in his back. He was there for 2 weeks, and they said, "You got to come get him. He's got to go home. Medicare's not going to pay anymore." So what do you mean? He couldn't bathe. He couldn't dress. He couldn't shower. He couldn't do anything. I think I put about 40 or 50 hours a week for 3 weeks over there after work. Pretty much full care for him. This is a growing trend. Nursing homes are just basically, they don't have the staff and the money. They're just cutting you out of there. So that burden is being pushed back onto the public. Another good reason to have long-term care, especially one that you pay a family member or a friend. Help wanted, more healthcare workers, another shortage. Healthcare workers don't want to go to people's houses. They're worried about COVID. So we're running out of those too. Flu cases lower than normal. That's because we're, quarantining. COVID-19 shocks the U.S. health sector. Another good article. Studies show how fewer COVID-19 cases at home than a nursing home. That's what I was talking about, where it's 61% of people would rather die. Well, that other stat was really interesting. Was this 3% people that care at home, 3% chance of contracting coronavirus, 1% chance of dying. And you look at a facility, 37% chance of getting it and 11% chance of dying, 11 times more likely if you're in a facility. Good article there. Americans worry more now about their long-term care plans and prioritize staying at home. That right there again, we're talking about choice. These articles are all just everything I guess we've been saying forever, but the coronavirus, for whatever reason, has given it meaning. It's given it some backbone. All right, so that's a good one. There's a lot of hot links into it. That's one of our pieces there. Going down here, articles. We put a couple good ones in here. So this one's one of the ones we use. This is what This is This is the Wall Street Journal, nursing home, coronavirus, and Medicaid. Good stuff in here. Talking about everything I just kind of mentioned here. Great article. Impact of COVID-19 and long-term care insurance. This is really good. This is a little longer one, a little deeper read, but some really good stuff in here by the American Academy of Actuaries. A little deeper dive here, but good reading, really is. I think it's about 15 pages or so. Yeah, it's 20 pages. Lots of good stuff in here. Just really help you paint that picture. And, I share some of these articles with my clients. If I do a pre-approach letter, I'll get a copy of this Wall Street Journal and put it in with it, or a couple of them. I've been emailing these articles out to folks, just painting that picture. Okay, white paper. Now, this is something that one of our agents, a very good long-term care agent of ours, actually Margie Berry, put this together. Just basically talking about the impact of COVID and our industry. Underwriting ramifications. So who will take cases and who won't in lieu of someone already having tested positive? So every carrier is a little different here. And again, you can read through this. Some will need to wait for 30 days upon a negative test, or 90 days, so they all have a couple little quirks there on what you can submit, what you can't. So that's a nice little piece there. That there's 3 of them here. I think we have the 3 companies, what they're doing with their different rules there. So if we click here, yes, it's just more of the same one here. Underwriting ramifications, virtual assessments. So explain to you how these virtual assessments will work. If people don't want the nurse coming to their house, and for a while they didn't make exceptions on this. At least I know Mutual. I lost a couple big cases. A broker in Massachusetts that lost some massive cases because they didn't want the nurse coming to their house during COVID. So finally, Mutual had a workaround here. They're allowing this virtual face-to-face visit. So thank goodness, because it was a real concern. So these people have been holed up forever, and they want long-term care, but they don't want to have to do an interview. And so they wouldn't allow them to look through a window. I even asked Mutual if we could, have the person meet them in the garage, maybe sit 6 feet apart, and they could then go look at all the windows, walk around the house. But no, they have to be in the house. No exceptions. Well, now there's exceptions. We're seeing these virtual assessments. A couple other pieces here. We'll wrap up. We got, so what was the underwriting? Then we got ways to start the conversation. These are just basic things here, guys. The current situation, have you had any family members? Have you had to not be able to visit your parents or elderly parents for the holidays or for recent birthdays? And they'll tell you, I'm not able to go see my mom. She's been afraid. Or concerns about spreading the virus is widespread. Have you been doing Zoom meetings, or have you done some face-to-face? We've tweaked some of these, but they're just more or less just questions. Just say that, just leading questions to get to open that conversation. Have you heard much about the pandemic and nursing home deaths? Is that something that concerns you? Do you have family or friend that have been in a facility that have been going through this? Have you had to do through the window visits, or do you have any family that's suffering from isolation? These are all just lead-ins to why we start planning for care ahead of time. It's very important, more than ever, to plan for your care in lieu of the fact that everything's kind of going to heck in a handbag. What else we got here? So, and this is similar to this one. That's open questions. Remember, this is, again, ways to start the conversation. These are just open-ended questions again. And we just, because of the pandemic, were you unable to be with family? Because of the pandemic, have you tried getting your groceries, food, or prescriptions delivered? Do you have any family or loved ones in a nursing home? With facilities on lockdown, do you know anyone that's been feeling the effects of the isolation? These are just, again, leading questions. You know anyone that had to scale down their wedding or their funeral because of this pandemic? These are just, again, lead-ins to start talking about that pandemic. All right. So those are kind of 6 pieces we have. I also have a pre-approach letter. I got a couple of versions of it. We actually tweaked it. I was still kind of changing it last night. So, we had a bunch of pre-approach letters. We're just kind of tweaking them, but we're having this basically speaking to the coronavirus. The fact that many Americans have this concern of corona on their mind. They're worried about, going to a facility. They're concerned about having a plan more than ever before. They're worried about where they're going. They want to be able to predetermine and try to do whatever they can with insurance to give them that choice independence, which is what we've talked about all along. Our industry is set for this. This is what we do. And when I started talking about the opportunity, again, it's an obligation, folks. I'm going to wrap this up. You guys can go ahead and take a look at this. It's on our website, goldencareagent.com/six-pack. I don't think I had to be this long, but I want to go through it, kind of where the premise behind it was. We're going to keep adding more pieces on this Corona page. So, folks, take advantage of it. We'll get that pre-approach letter out to you. We're going to do a couple versions to existing clients, then maybe just a generic letter you mail out to the masses. So look for that. We'll probably make it an email version as well. I think we'll have both those done maybe today here. So a pre-approach or an email blast. So take a look at the pieces we have here for you, but mainly just start talking to your clients. They're scared. They need you. Trust me. Couple open questions. Start that conversation. They're waiting for someone to call them and ask about this. People are very receptive to long-term care right now, or home care only, or what have you. Yes, you can use the corona thing as an impetus but paint the picture. Everything I just talked to you about. The care that's out there is not getting better. The government's not going to be there. This is going to be a very, very scary situation 20 years from now when that senior population doubles and the nursing homes are disappearing and the staff is disappearing. We're simply running out of places to put people, and we're running out of people to take care of them. And corona just, again, it's like a powder keg just waiting to explode. So anyways, with that, your people are scared. They need you. Go out there and talk to them. Let us help you with some of these marketing pieces. If you have any questions on this, give us a call to the marketing office. We'll get you what we can. The marketing office number here is 800-842-7799. And I want to thank you guys. Again, this is Jeff Clark. I don't think I said that to begin with. I want to thank you guys that were on here. Looks like we got a pretty decent crowd here with 40 people on here. So I hope it was useful for you guys. Again, this is just something we put together just to kind of get it all in one place so you guys can kind of see it. We all kind of know about this stuff, but just think through all the ramifications of it and what's really caused out there. 81% of people are interested in hearing about long-term care right now. You think you ever hear that stat? Like people you talk to nursing home and cold call, wherever you couldn't get much reaction. But right now, it's the best time to ever offer them. So all your training is for now. So go take advantage of it. I'm going to see if I can go to our end screen if we have an 800 number here. No, we do. So our number here at the marketing house, again, 800-842-7799. Give us a call if you need any help. Other than that, good luck selling and go help your clients. They need you.
Check out our website, GoldenCareAgent.com, or give us a call at 800-842-7799.